Hey, so we're coming live from our home gym, and we wanted to talk about what physical therapy is, how we're different, what to expect when you first come to us, and what to expect moving forward as you're progressing through your plan of care.
Yeah, so I guess we should go over first like what standard physical therapy looks like. We're here in the United States, we're in Annapolis, Maryland, and typically when you go to a physical therapy clinic that takes insurance, there's a high volume of patients that come in, and the therapist will see a patient and do an evaluation for a certain period of time, and they may or may not have time to get into a whole treatment during that session. I'm sure they're able to do some things, but maybe not a whole treatment.
And Cara and I started working in a practice just like that. And it was really that high volume, turnover, fast pace that was one of the main reasons why we wanted to do what we're doing now at GOfit and what we've been doing now for going on 5 years.
Yeah. So at the standard clinics, then when you come back for your treatment sessions, then you'll spend time with a therapist a little bit usually, and then you might then work with an aide, and that aide may be somebody who's just a high school student or something like that who has just been instructed to lead you through your exercises, and that person hasn't necessarily been trained to look at exactly your form and that sort of thing and what you need, making modifications if it's like too hard or too easy or you're not doing it correctly. So that's kind of what the standard looks like. And then you're getting, so for your treatment session, you're getting essentially what your insurance is dictating that you need. So if your insurance pays back the clinic more for therapeutic exercise or neuromuscular reeducation, then that's what you're getting. So if you really need manual therapy, hands-on stuff, maybe you're not getting it because the insurance company is paying more for the other types of treatment. So that insurance company really has a hand in like your care, and you end up going back many times a week because these clinics obviously need to make a profit.
Yeah, they're running on high volume.
Yeah, so you might be going in 2 to 3 times a week. So that's kind of what the standard is, and that may be right for some people. Kyle and I decided, like he said, to branch out because we noticed that it was so fast-paced that some of our patients weren't getting better. We couldn't spend enough time with them.
Yeah.
B, it was not good for our health. We were, really taxed, and it was stressful and exhausting. And so now that we've made a shift to our own practice, we're so much happier. And then transcends into our patients too, and our care is so much better.
Yeah, I mean, we have more time to spend with people one-on-one. We have more time to actually think about them outside of the clinic, which was not the case before because you were just worried about the next one coming in the door after that. And yeah, so it's really made our work life better, and it's made our outcomes better, which means people don't have to come to us as much as they would compared to other places. Yeah. And they usually get better faster.
So we typically see people 1 time a week, and we'll see them pretty consistently up front, and then things start to taper off as people get better. And we do expect our patients to do their homework. So we'll give you lots of stuff to do at home. We will watch you while you're there. And make sure everything looks really good, and then you are doing it on your own so that you can spend your time doing what you want to do. You don't have to keep coming to PT many times a week. That's a lot with the travel time back and forth, and that way if you're working or doing something else, you just kind of slip into your exercises or do them in the morning before you start your day. So it makes it a little easier. But also we should talk about like what our setup looks like with the evaluation sessions and.
Yeah, so we're manual therapists by training. We're both fellows of the American Academy of Orthopedic Manual Therapy. That's kind of how we're able to front load some of our treatment and then spread it out as people progress. So we use our manual therapy skills really to reduce people's pain, and we use our kind of therapeutic exercise, neuromotor control exercises, to get them to change kind of their habits, their movement habits, to make long-lasting changes. So as their pain is going down over the first few weeks, their home programs are being uploaded, and hopefully that meets at some point in time and space over, the 3 to 4 week period. Mm-hmm. And then we can start to spread out the visit treatment as they continue to upload and get stronger. And then we're able to kind of do that because our evaluation is a full evaluation plus a
comprehensive,
looking at not just the area of the pain, which is usually kind of the symptom of what's going on, higher or lower. We're able to look at the whole person. It's very common that someone has an ankle or a knee problem, pain, because their hip is weak or not moving correctly, or they don't have range of motion in their spine, et cetera, et cetera.
Yeah, so what you can expect when you come in, the evaluation is a full evaluation. So like Kyle said, we're looking at you like top to bottom, bottom to top, looking how you're moving, looking at your range of motion, your strength, your like muscles, trigger points, your movement patterns. We do all that the first visit. Then we're giving you a full treatment that first session too. So that first day, you're getting, something to have you head in the right direction. So that usually includes manual therapy, and what that is hands-on techniques from us onto you to help with the tightness trigger points, with joint mobility, how that's moving, how the fascia's moving, gliding, all of that stuff.
How your nervous system's moving.
Yeah, so, and then we'll give you actionable things to do at home. And then when you come in the next time, we kind of take what we saw each time we see you. We do, take a first few minutes to go over how where things were, quickly reassess, and then we'll go into your treatment session. So I think that kind of answers it, and we're with you there the whole time. So like I kind of touched upon before, one of us is watching you do your exercises. So if right on the spot something doesn't feel good, we can say, hey, look at how your hip is dropping right here. Let's pick it up a little bit and let's see how that changes things. Or let's get you into this position, or do it, on the wall, or we'll modify. Lots of things. In that sense, we can make things easier, harder. We're making sure it's appropriate for you, and then you're not wasting your time. You don't need somebody just watching you do your exercises, because you can do that at home.
Yeah.
Or
as long as
as an aid,
doing it
an
right.
aid. You don't need an aid doing it.
As long as we know you're doing it right.
Yeah, well, after we set it in the clinic, then we make sure that you're good to do it at home, and we oftentimes send people home with videos so that they can look at themselves doing it and all right, these were the cues that helped. And we're also very communicative with our patients when we're not together. So if our patients have a problem, they can always send us a message, and we'll figure it out together. So I think those answer some of the questions. Were there any other main questions about our clinic or physical therapy, what that looks like, what we do?
And generally, I would say that different clinics focus on different groups of people. Our focus is really, we're more of a holistic provider for adult athletes. That's who we like to work with. Really, that means, if you like to run, if you like to lift, if you like to do yoga, if you like to walk for exercise, if you consider yourself some sort of athlete that falls in that box, we want to work with you. If you're goal-driven, we want to work with you.
Yeah. So we oftentimes help people work towards whatever milestone. It could be just, getting a lift in the gym, like they're really working on, squats and they're noticing that they're getting pain with it now, or they're doing chest press and now they can't because their shoulder hurts, or, they're training for a marathon and now they have pain in their patellar tendon. So,
or they're just trying to get their first 5K.
Yeah, or that.
Or 100 miles.
Yeah. So we really work with a variety of people, variety of athletes, and we love doing that. I work a lot with women who are pregnant or postpartum, or like looking to get pregnant, just on core, pelvic floor, mechanics, mobility. There's so many changes that happen during that time, and that's like near and dear to my heart, because I feel like when I went through that, it was like a wild change to myself, and I learned so much just going through it, and then taking more classes and really diving deep into how to treat women and get them feeling as good as possible. And so I love working with that population, and we see a number of those.
And that's
people.
Not immediately postpartum either. I mean, this could be years down the road.
Years later. Many years later.
Have, continued.
Yeah. So
yeah,
I think that answers a lot of questions. If you have any questions, feel free to pop them in the comments, or send us an email, info@gofit-pt.com. And we look forward to hearing from you.